would like to actually tell you about today's session, what we can do and what we can't do. And what we can't do is going to be in the sessions that we run as a company at OET Medcamp. We have so much activities going on for the people who wants to pass the OET exam. We have a good record of helping candidates go abroad, go to America, Canada, England, Australia, New Zealand, and the other countries that we are dealing with. I'm sure my staff know, our staff know much better about it. I have been in academic staff for some years, and the purpose of this webinar is very simple. I'm gonna introduce you a couple of big things, a couple of role play cards. Not all of them because we can't do it. If you want, you can always join our live sessions every week. We have a lot of videos about how to be successful in OET, both in Turkish, English. Well, of course, from my side, it's mostly English, but I'm sure you would enjoy Kadar's fantastic videos in bilingual formats. Other colleagues doing a good job there as well. We have subtitled and whatnot. Okay, without further ado, I don't want to actually make this session long. What I'm gonna do is threefold. I'm gonna first give you the big picture. What is a speaking subtask quickly? What are the station looks like and what the assessors are looking for? And then it's like a workshop. We look at some role play cards. I will ask you some few questions like to make it interactive. But remember, basically webinars is me talking too much, which is something I like. But I would like to also invite you to kind of help if you can in chats. If you want, you can open your microphone. And especially you can do that at the end when we are actually taking your questions. Like I said, I'm very talkative. I should control myself so that I can have like 10 minutes at the end for you to ask your questions. If I manage, that would be fantastic. I also try to see if you didn't have a lot of questions, then we can have some role plays even more in detail. I have some role play cards. Remember, the role play cards that we are practicing in our institution cannot be found anywhere else. 100% guarantee. They are the most authentic, real life-like cards you can practice with, and that's let's say a strength of our institution. Okay, let's get it started. This is let's jump straight into what speaking is. Look, speaking is 2 role play cards. That's it. You have 2 role play cards. On the exam day, you see 2 of these little cards, scary bullet points and so on. And then you have like 3 minutes for each of them to prepare, as it is 3 minutes. We give you 3 minutes and the clock is ticking for you. You can look at the time. I will explain how the dynamic works. But basically you have 3 minutes to think, take notes, write, and then you talk for 5 minutes. And then, of course, there are some nuances in 5 minutes and what it involves, but there is 2 of these cards. And they say officially, if you look at the website, the OET website, official one says 20 minutes. But in my experience as an interlocutor, I've never finished the test in 20 minutes. It's always either 24 to 25, 26. Because, guys, we have to settle down. Like we started, I particularly like to warm up a little bit more so that the stress level drops for our beautiful fantastic doctors and health professionals. You know why? Because I know what it feels to feel stress when I go and see a doctor. This time doctors are having a stress seeing me, so I want to be professional and reduce their stress. That's the first time that I feel a stress and I don't feel a stress and they do. And I just want to help them as they helped us all the way. Let's look at the cards a little bit more later on. I mean, I'm not gonna pass this quickly. but this is the big picture. 2 cards, and like 8 minutes per card, official one, and like 25 minutes, and then you're out of the exam room, hopefully safe and sound. So what happens inside the room, inside the station, what we call it? First of all, you enter, like I said, you come in. We have some warm-up questions, but we have also a form. Generally, I say something like, okay, welcome, come in. And when you enter the room, if it is face-to-face, it is recorded. If it is online, also as soon as you become online, it is recorded. Everything is recorded. The only difference is that in online, your video is recorded as well. In face-to-face, only your voice is recorded. And then we invite you, you sit down, we settle you down. There are some questions like, can you, that's the first question we usually ask. Can you explain your professional background, or can you tell me a little bit, that's exact word. Can you tell me a little bit about your professional background? So you should be prepared for it. Say, I am Michael Askari. I'm the doctor, medical doctor. I am a specialist. I have started working in this hospital, finished there, and that's that sort of information. But basically, nobody cares what you're saying, except it's a way for you're really getting into the mode of exam. So don't worry about it. Don't worry about stressed words or making mistake or things like that here in this warm up. But the good practice is if you prepare yourself a little bit for that, also gives you better feeling. So I generally say, yeah, even if it doesn't have any score, still prepare for it. Kara, do you have a question?
I just wanna, I didn't want to interrupt,
Yeah,
but
yeah, go ahead.
wanted to ask the people here if they know what is an OET interlocutor really mean. Because, when I was
Mhm,
studying OET myself, like 2 years ago, I really didn't know the difference between the
mhm,
assessor and the interlocutor, and it's really
mhm.
important that like people here have a chance to
We
talk to
will.
a real OET
Mhm,
interlocutor.
mhm,
And also to spice the
mhm.
meeting up, maybe, we can do retouches. I mean, because I know Turkish, I can do bilingual retouches when it's
Yeah,
necessary.
yeah, yeah. Jump
Um,
in, jump in.
so
Yeah, when you said spice things up, I thought maybe you are asking me to do my crazy dance moves, but maybe we can leave that to the end.
By the way, I gotta say,
Yeah.
in the past, there were students of Medcamp who
Uh-huh.
actually had the tasks while
Uh-huh.
the interlocutor was Michael in the real task, and it was a really, interesting experience.
It
And
was
I think
for me and
students,
for students, not the
that
students,
those
doctors.
students, yeah, are very lucky to have you as an interlocutor because you're very talkative and you kind of higher up the energy of the candidate. That's very important. Not all the interlocutors are that way. So to do the Turkish touch
Kader,
here.
don't forget, I'm Boğaziçi teacher
Yes,
and I
of
love my
course.
students. And everywhere I go,
Evet.
I just say, as a teacher, it's my duty to help these
Yeah,
fantastic people. And I've been very
yeah,
lucky to have all of these,
we
let's say,
are also
opportunities to
lucky.
work with these talented people. Um, this is a privilege.
Yes.
I'm not just saying this for the audience, but gerçekten this is a real privilege for a person to work with very talented, highly educated people like you, and doctors, or at Boğaziçi, I'm dealing with talented students. So
Hmm.
they are making me smarter because they're asking questions. They want, like, they kind of like force me to be a little bit more on
Hmm.
my toes, ready, prepare, and serve at my best capability
Hmm.
possible. So let me just go on because I'm mindful of the time. So,
Yes.
but feel free jump in if there was something
I
which was.
I'm sorry. I just wanted to ask if there's anyone who knows the difference between an OET interlocutor and an assessor. Interlocutor ve değerlendirmen arasındaki farkı bilen var mı? If so, you
Um,
can raise your
I
hands.
I will explain. By the way, I will explain this later on. Let's just then I will
Yeah,
ask.
let's just let
Okay.
them think. Okay.
Yeah, yeah. Let me. think about it until I reach there. So when you come
Good.
to the room, you settle down, you warm up, get warm up questions. You fill out your name, not your your name, but mostly your candidate number, and then you sign the form, and then we will after that move on to the
Ben de
warm up
söyledim de
questions.
gitmedi. Ben yakalanmayacağım.
And then we go to the second part, which is like exactly the first card that we start with. Remember, the card is folded. It's like two cards in one go, but it is folded, and you only work on the card that I tell you. For example, it is like if I say, let's start with a card number 4 for medicine or 3 for nursing. Be careful, that should be correct. And then do not because this happened, because doctors or people who come into the room, they are full of stress. Sometimes they turn over the card and they actually prepare for something else. This once happened, but it should be my duty to check. However, you should also be mindful. Remember, there is a card number that they call. Usually the card numbers start from 1 to 6 because that's the set of the cards we receive on the exam day as an interlocutor. And I will tell you about the difference, by the way. After the first card, you have 3 minutes to prepare, and you see the time. The timer is on the desk, visible to you. And of course, the interlocutor is also checking and checking. You can take notes. The interlocutor gives you a pencil and then a card. You can write on the card. You can take notes. You can look at it during the test. I mean, after 3 minutes, still you have the card for that 5 minutes. So you can look at the card and speak. Nobody punishes you for reading the card or looking at a card. Nobody expects you. I mean, this is something that they say for communication. Eye-to-eye contact is important. It is important when it is assessed. To be honest, in my experience, it doesn't really affect you because you are in the room. You are more like busy with the data written on the card than interlocutor beautiful eyes, in my case. So you don't have to look at my eyes or interlocutor eyes while talking. It is just it is a kind of like communication strategy when you are in a real scenario out there in the hospital in, let's say, Ontario, Canada, or America. So then we do the same card right after the first card is finished. We do the same card, second rhythm, the same format, the same strategy without any pause. And at the end, we say, okay, this is the end of the exam. Can I have the card? And then I collect the card and we move on. Remember, the key is use the 3 minutes strategically. You should actually read and kind of anticipate a lot of things. And for that, we have fantastic videos on our portal. We have, because I cannot explain everything in 5 minutes, but I can actually guide you to just the whole picture. Let's move on to the what Kader asked. And now it's the time to actually say, what's the difference between me, interlocutor, and assessor? Well, who knows? Anybody? If nobody knows, I can ask somebody randomly. I'm not gonna do that.
That'd be fun.
That would be stressful for a person who's
Yeah.
picked, and maybe
I
they are
know.
in the office or driving.
Maybe there's someone who wants to answer.
Yeah, any volunteer to tell us what's the difference between interlocutor and assessor?
We have an
Okay,
honest, I don't know, in the
okay,
chat.
that's fantastic.
That's fair.
Yeah. So let's just talk about it. I am interlocutor means I am there to conduct the role play. My job is to give you an experience of a patient. So I'm a patient. I'm a professional patient. So you are a professional doctor. I'm a professional patient. And then your recording goes to real assessor who assess your language and assign you a band. And that happens through these two family of criteria that I have listed here. And I'm going to explain quickly. So basically, we have 9 criteria. 4 of them are linguistic criteria you're all familiar with. if you have ever taken English exam or any language exam, these are the criteria that you usually face. But you are doctors or healthcare professionals, then that's why we give you these 5 extra treatment or extra, let's say, options. These are clinical communication criteria specifically made for doctors. That's what assessors do. They actually put a check mark or assign a band score for each and every one of them for each of your cards, by the way. Remember this. It's not happening just holistically. For every card, for every sentence you say, they do it. And let me just go through them quickly because, like I said, these are all very detailed and you can actually do it in our portal if you join our system. And linguistic criteria starts obviously with intelligibility, which is like your clarity, how clear you are, how is it clear to listen to you? Is your pronunciation kind of make it difficult for the patient or not? By the way, here accent is not important. I mean, accent, you can have your beautiful Turkish accent and it's just cute. It's fun. But pronunciation is different. If your pronunciation is really off, then the people don't understand you. That's why you lose a score. But if you are fairly clear, and then you can actually get 0 to 6. By the way, by fairly clear is that I should not really try hard to understand you. That's why we call it intelligibility or clarity of the pronunciation. And the second one is fluency. Fluency is really important. If you are like me, and I've also been preparing candidate for IELTS exam for many years, in fact, for 15 years, and there, fluency is actually number 1. You need to speak really without so much pause, without so much hem and ha. Your speed, by the way, it should not be really fast or really slow. It should be natural. I'm not natural a little bit. I speak a little bit faster than most people because I generally try to convey a lot of information. But in the clinic setting, you should have a little bit of slower, a little bit, let's say, natural communicational strategy. Appropriateness of language is obvious. You cannot use slang or street talk. You should use professional. So, so as a doctor, I've seen some doctors make mistake like, "What's up?" Don't ask what's up. What's up is for friends. Okay, you should say something like, "How have you been feeling?" That's more professional. Okay, so use professional language, and then we have grammar and vocabulary. So this is funny, isn't it? Like you think when you're talking about linguistic, you think that, oh, grammar and vocabulary comes first. Okay, that's not true. Grammar and vocabulary is only 25% of the whole linguistic criteria, and that's interesting. So if you are worried about your grammar so much, do not worry so much about grammar because that's a Turkish education system. They actually force you to learn so much grammar, but when it comes to speaking, they don't give you enough speaking practice, which is really more important than grammar, because with a perfect grammar, you cannot speak. But with a perfect speaking, let's say, strategies, your grammar mistakes are forgiven, like that. And then let's go to the beautiful criteria of communication, clinical communication, which, like I said, I cannot explain it really in one go because it's really something that you need to take our course and see our videos on our portal. I'm sure my colleagues gave you the explanation on how to be comfortable with this. And also, if you ask people or doctors who took my live sessions, then they came and we practice one-to-one, or sometimes we practice a couple of cards, you will see how these clinical criteria that actually look a little bit fancy or weird, they come to life. The first one is in a relationship building. You should build a relationship in 5 minutes and say, how can I build a relationship in 5 minutes? I've been trying to build a relationship with my wife for 20 years. I failed. How can I do it in 5 minutes? There are some techniques you can use, and these techniques are gonna be helpful, hopefully even in your marriage. But I don't guarantee that because I failed myself. So still my wife says, I don't understand what you're saying. Anyway, so relationship building is important. After that is understanding the patient's perspective. You need to show there are some techniques, there are some phrases that you can use, and that shows your understanding of the patient's perspective. And then providing structure. Providing structure, as the name suggests, is like, okay, guys, we're gonna do this, we're gonna do this one next, and the last we are finishing this with this way. It's not a big deal. I'm sure you will see some examples of that later on, hopefully. And then information gathering and information giving. Actually, if I want to look at every card, it's two-part. From the start of the card until the middle almost, it's information gathering. You collect the data about the patient's history, the pain and the onset and the degree of severity and the family and general health condition. All of that is information gathering. And from the middle of the card, you switch to information giving. That's where your doctoring starts. You're trying to use your immense knowledge to give the patient the best advice or diagnosis or prescription and all of that. And like that, as I said, I look at the card, I only see two parts: information gathering, giving, and these three parts on the top actually are inside in these two. But you can tell me, Hocam, why do we have five? It's Cambridge, guys. Cambridge wants to have more numbers, look fancy, but we know better. It's all about business, you know. They want to say, look, we have five clinical communication. It would be very like funny to say we have only two: information gathering correctly and information giving also properly. Anyways, the surprise part for starters is that so many of you, if you're a starter, you need help in this area. That's why in our live sessions, we generally focus on this area. Why? Because this part, first, you are familiar with, and in a live session, we cannot actually fix this. If you want to fix this, you have to join other courses that we offer, like our general English course, if your English is not that good. And if you understand me, by the way, it means your English is great. So you need to join us for clinical communication part. Okay, now, let's go and look at the anatomy of a role play card. You know, because you are doctors, I use the word anatomy. So just, I'm sure you have passed exam of anatomy in your studies, right? Anatomy 101 or something like that. Was it? So, difficult course. I think doctors hate anatomy courses, right? That's my guess, because who needs a skeleton, guys? Who needs a skeleton? All right, so let me just go through it quickly. When you receive the card, basically you will see the setting here that shows where this conversation is taking place. This is a doctor's clinic. It could be local clinic. It could be emergency department. It could be local hospital. So is this important? Sort of, not always. It just kind of helps to set the tone in the right way, okay? And then it could be also in other professions. We can have, if it is a veterinarian science, then it is a vet's office. And if it is, let's say, nursing situation, then you have, and again, like a hospital or clinic, it's probably the same. So depending on your, let's say, profession, the setting changes. But the part that I like you to understand is this part, is the background part, which is very important. The background part is when it tells you, look, this is the situation in one sentence, two sentences, that's it. And you please do not start with this as a start of conversation. This just gives you idea. And also, more importantly, it tells you if this is a start of the conversation or middle of the conversation. How? For example, if you look at here, you see an 18-year-old patient who has had a moderate acne vulgaris for several months. You have just examined the patient, means you said hi. Don't start with hi again, because you already looked at this patient's legs or abdomen or shoulder or head. So you examine that person. You just need to say, thank you for letting me examine you. Before we proceed, I would like to ask you a few more questions about your medical history, if that's okay. And then the patient obviously says, yes. Okay. Do you have any health conditions? And the patient says yes or no, depending on their role play cards. By the way, remember, here I'm just showing you your card, but I have a card too that matches this exactly. For every bullet point, I have this. So after this, you start, the real task is here, as the name suggests. Your task is to go through these bullet points. And if you look at them, each one of them starts with a imperative verb. Imperative verb means this: do this, don't do this. That's it. And you are doing that. That's your job. For example, find out. So what am I gonna do? I'm gonna find out. Explore. I'm gonna explore means, again, ask more questions. Advise, give advice. Reassure, give information. Advise, give information. Do you remember I told you that if I look at the card, I say, okay, bullet points 1 or 2, information gathering, 3, 4, information giving. And if you look at here, find out, basically, 2 bullet points are information gathering. And bullet 3, 4, and 5 are information giving. We are giving information. Simple. Okay. I don't like complexities. I want to make things easier. Second, each of these bullet points are tasks that when you are finishing, you are switching to the next task. So you need to use these switches very well. Like you need to use transition words. Otherwise, you are gonna end up really doing something that is not really professional, and it's not gonna make your life easier. So I always say, like, finish this, involve the patient, use the transition word, go to the next one. Ask the questions, use a transition or in some fixed phrases to go to the next one. And something that I always tell my dear professionals, that, look, you have information gathering a stage. When you switch to information giving, summarize. Give a summary, quick summary, 30 seconds, 20 seconds. And that's very, very important. But before that, before we go further, the first thing you need to know, okay, how do I start? It is we have different cards, by the way. I can tell you like 3, 4 different types of the role play cards. I don't have really time-wise enough time to go into detail in each one of them. But here, just to give you the sample, we are going to work on 2 of them. Sample role play, that is the first time visit patient. So the patient is visiting you for the first time. You don't know this person, so the introduction. Second, you're talking to a patient's parents, so you're actually talking to a relative. But we have some other types that you are actually mid-consultation, like this card that I showed you. This is a mid-consultation because you already started and you're just continue your treatment or diagnosis or your consultation, let's say. And we are not going to talk about that with some real examples, but I invite you guys. We have more examples like this. You can invite you can join our live sessions and actually have practice with me, or you can actually see some colleagues of yours practice with me. And we have all sort of arrangements for you to help you pass this really terrible exam. I shouldn't say that, but who wants exam? Everybody wants to pass it and move on. Yeah, nobody says, "Oh, I love exams." Well, except me, because I make money from it. Okay, that's different. I love OET exams because they are different for me. For me, is a source of income, and more importantly, as a place that I meet fantastic people like you. Doctors are amazing people. All right, let's move on to the first type of role play cards. Like this one, it's a first time. Why? Because oh, is it the first time? It is a mid consultation. I think I mixed up the cards, but it's absolutely fine. What we are gonna do is imagine this is the first time. Let me just switch to a card that is first time so that you can see it. I have some cards. Let me just go and show it to you immediately so that it's at the end of my card so I can show you what it is. For example, this one is a card that you can see this is the card you see, and this is the card that I see, and this is a card that is first time you haven't seen this person. It's not the middle. You haven't examined this person. Find out the reason. When you see find out the reason for the patient's visit, that's a sign for you that this is my first time visit. So how do you start? What is the first thing you say? Is there any routine for it? What do we do? Any idea? Anybody? I guess most of you know that we start by
Hello.
yes, we call that
Greeting.
we call that exactly. We start with greeting. We start with introducing ourselves, and the first thing we say is hi. Then you say I am Dr. Askari. Why the last name? Because you are a doctor and this is a professional register. Do you remember I told you appropriate language? So you need to use appropriate language. Say, I'm Dr. Askari, one of the treating doctors in this clinic. That's why setting is important. Yeah, if you look at the setting, if it is a hospital, if it is an office, clinic, whatever, you can use it. If it is emergency department, you say, hi, I'm Dr. Askari, one of the treating doctors on duty in this emergency department. That's how you first introduce yourself. And then you say, ask the person's name because you don't know this person's name. That's relationship building. So you need to ask that person's name. And I want to go back to our formula for it. There is a very simple formula. I'm gonna just walk you through. This is the formula actually. Greet. So that's what we talked about. We greet the patient. It could be good morning, good afternoon, depending on the day. For if you are face to face, it's good afternoon because it's in the afternoon. In the morning, you have the test. If it is online, it could be morning. So good afternoon, good morning. Welcome to our clinic. And then you introduce yourself. I'm Dr. Askari, one of the GPs here at this clinic. Or you can say I'm Dr. Askari, one of the doctors on duty in this clinic. Okay? One of them, it doesn't matter. Just make sure you're very comfortable with it because a strong start gives you confidence and also boost your score. And it's very simple. After that, you confirm the person's name. Could I just confirm your name, please? And how shall I address you? This is two-part question or depends on how they answer. For example, can I just confirm your name, please? And if Kader Asar says, I am Kader Asar, they say, okay, how shall I address you? Then Kader might say, you can call me Kader. But if I say, could I just confirm your name, please? And Kader says, I'm Kader. I say, okay, thank you, Kader. I don't need to ask how shall I address you because the person already said first name. Okay, please don't act like an automatic machine. The first part is more important. Like how could I just confirm your name, please? Then I say, well, I'm Michael. Then you say, nice to meet you, Kader, for example, name of the patient. Nice to meet you. And then it seems like it is your first time to visit us. It is optional. Gerek yok. It's just option. I don't use it myself so much. I just say, nice to meet you, Kader. And then I start the question. So the question is, of course, what brings you in today? Or how can I help you today? This is a professional. So all of them goes on for the first time visit. Bam, 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 together. In 30 seconds, you set the start successfully for the first time visitors. Okay? It's the first time visitor. You go through it like this. Let's do some practice, quick practice. Can you write in the chat which one of these options is the best start for getting the highest score? Just write. I have Emre is one of the nurses here, so welcome. Can you write which one is the best answer? Oh, I have so many smart people. I don't need to actually. Guys, thank you very much. It seems all of you know the answer. I don't need to actually teach you. You already know everything. So the answer is B, obviously. You need to greet the person, introduce your role, confirm the name, acknowledge the first visit, or sometimes, and then ask one open question. Every relationship building box is ticked. So the assessor is going to be happy with you if you do that. The assessor will say, wow, this person knows what to do. Now, what are the phrases? Arkadaşlar, this is called phrase bank. I love phrase banks because that makes your life easier. And now you don't need to be creative. You're always asking the same questions in Turkish when somebody visiting you. You are not trying to be creative every time a visitor comes to your room. You just use the same language, right? So you can actually learn one or two of these. Hello, I'm Gina, and I'm the nurse on duty today. If you are a nurse, if you are a veterinarian on duty, if you are a dentist, if you are a doctor, physician, or whatever. So it doesn't matter. You just say, I'm on call today if it is in the emergency department, or I'm on duty. Or you can say, I'm Dr. Smith. I'll be taking care of you today. I'm Dr. Smith. Why Gina didn't say I'm doctor? Because Gina is not a doctor, it's a nurse. That's why they say just I'm Gina or I am Michael. But if you are a doctor, and it is like American thing, maybe English thing as well. When you say doctor to somebody, even if everybody thinks that medical doctor. So if you call me, if I have a PhD and I call myself doctor, they really think that I'm a doctor. So I cannot call myself a doctor, Michael Askari, ever in the United States because I'm not a medical doctor. But anyways, that's why I try to call here myself a doctor because that's the only place that I can call myself. I'm Dr. Askari because it's a role play, right? All right. After introducing yourself, you confirm the person's name with these questions. Could I just confirm your name, please? Please be comfortable with this. Practice this, repeat it, and say it like you own it. Could I just confirm your name, please? And that should be part of your routine so that you don't even think about it. That way, you increase your fluency and your clarity. It's Mr. Jackson, is that right? If it is a mid consultation or follow-up. Remember, we also have follow-up cards. We don't discuss today, but it's part of it. Maybe in another webinar, we can actually focus on follow-up card or mid consultation if you have time, or I think we will have some other webinars. That would be a good idea to work on. Do you prefer Karen or Mrs. Jack Johnson? If you know the person's name, you can do that. And then opening the consultation. So this is fixed for every type, almost. If it is the first visit, we can say, what brings in you today? Or could you tell me a little bit more about your pain? This is something that you can also use a lot more. Asking permission. Oh, this is really important. Some of you say, why should I ask permission? The person is here for, but no, this is actually part of their routine. Asking for permission, asking for consent is really, really routine for anything you are doing, even asking questions. So you say, you should be very comfortable asking for permission. Like, do you mind if I, then the verb, if I ask, it's a simple verb. Do you mind if I ask a few more questions about your diet, about your health, about your general health, about your general health conditions? Is it all right if I have a look at the wound? Is it all right if I start examining you? Is it all right if I ask a few more questions about your pain? So these are two different ways of starting the questions, and they are amazing. Let's now go to oh my God, I'm running out of time fast. Like I said, I should speak less. Talking to a worried parent. This is different card. I'm gonna be faster this time. This is the card. You see a parent, the parent of a 2-year-old boy who has diarrhea, vomiting, and a mild fever. That's the background. Your parent is worried. The parent is worried it is more than just a tummy bug. You have just examined the child and diagnosed viral gastroenteritis. The child is not present for the discussion. Look, when there is a parent situation, the child is never there. You never talk to a child here in this scenario. In OET, actually, there is no card talking to a child, which is weird, but I think it's because of the standard of examination. Anyways, it's a mid-consultation, and you are gonna start asking more questions, of course, but you are talking to a parent, not the patient himself. Second, the parent is worried, so you need to actually be ready to lower their worry, as you can see here. And third, you need to ask the questions during those 3 minutes. That's the biggest difference. I mean, in the first one, you ask the question at the beginning of the conversation. Here, during the preparation, you can ask, sorry, how do I address you during the consultation? And then Kadar says, let's say, I'm Kadar. And then they say, okay, what is your son's name? Just write, okay, the parent's name is Kadar. The son's name is Bora. That's the name I use generally in my, because I'm a patient always. You're asking me. So if you come to my room and the boy is Bora always for me and the girl is Ella. Why? Because they are my favorite students. And that's why they just come to my mind, Bora and Ella. Anyways, and I'm Michael, so you can always call Michael as well. So you start like this again. The child is not there. You can start thanking. Thank you, Kadar, for bringing Bora here to our center. Look, here is a health community center, so it's a center. So you can say, thank you for bringing Bora to our center. I would like, before we proceed, I would like to ask you a few more questions about your child's Bora's symptoms. Is that all right? Because permission. Is that all right if I ask you a few more questions about Bora's symptoms? Sure. And then you can start onset. When did it start? When did you first notice it? And these parts have standard questions that we will actually talk very detailed and professionally in our live sessions. If you join us, we will discuss this more, but I am actually giving you some kind of order you can use. The first thing is that sometimes most of the cases you're talking to a parent, they are worried. So you seem a little bit worried, and it is in your card, by the way. It is in your card because you have to also provide some sort of empathy. Empathy is part of your relationship building. So you seem a little bit worried, Mr. Tan or Kedar. Don't just say something like, that's not a real problem if they talked about their problem or worried. Don't believe what you see in the news if they say something like that. Don't do it because that would be dismissing the worry. That's not appropriate. Instead, you notice the emotion, you mention it, and then you validate it. It's important. Acknowledge it. So it's completely natural to feel anxious about taking him home. If you are discharging, and if you are a nurse and you're talking to parents, also it is the same. If you're a doctor and they just worried, say, I don't want. Maybe it's serious. Maybe my son Bora should be in the hospital more. It's completely natural. So every time you say, I completely understand you. You are worried. I understand you. And that's exactly what we all need, understanding. And third, invite the concern. Could you tell me a bit more about your concern? What concerns you most? This is another question that can help. And then we can actually go through the only then inform. And then we provide information. Let me explain what we have observed overnight as a, let's say, nurse. So we go through, notice the emotion, validate it, say, look, I see that you're worried. I understand it. What worries you? That's a routine. I see it. I accept it. I'm asking. And then you explain. This is the golden order. And we really practice this in real time. Maybe it seems artificial right now, but if you come to our live sessions, you will see it is happening all the time. It's more common than you think. Validating first, like I said, I completely understand that what you heard was made you worry. So sometimes in my card, it says, tell the doctor or tell the nurse that I am worried because I saw something on the news. It sounds like that's a real worry for you. Could you tell me why you are feeling like that? Look at this scenario, okay? Which one is the best answer? Which one is the best way to really provide the support? Ooh, that's fantastic. A lot of correct answers from very smart people. Sorry, sometimes I ask these very simple questions, but that's the routine actually. B is correct because the person actually acknowledged it. I can see that story that you saw on the news frightened you. You explain the evidence. Let me show you exactly what we monitored overnight. You explain what you have done, maybe provide reasons. Don't generally just say this is important. Don't just say, don't worry. Don't worry is not good. What do you mean, don't worry? Don't worry should be backed up by reason, by evidence, and so on. And then say, we will go through the warning signs together. This is what we do together. So acknowledge it, accept the emotion, explain it, and provide a plan going forward. That's the routine. What are the, oh, this is important. I told you after every bullet point you finish, you want to go to the next bullet point in the task. You must be strategic and you must use transition words perfectly. And these are very good signposts that I'm gonna introduce to you. Qatar, I might finish like a little bit. Can we finish a little bit like 5 or 10 minutes over time? Is it a possibility or?
Of course, sure thing.
Because these are
have...
these are beautiful. I don't want to miss them. And second, I don't want to miss anybody's question. I am at your service. I have all the time in the world. Well,
yeah,
until my wife,
I think
until my wife, until my wife calls me, I have all the world time on my hands. Okay, because I have.
We can have extra 10 minutes. I think that's perfect.
Yeah. Okay, perfect. Thank you very much. Now I don't have to run through this that quickly. All right. Anyways, changing the topics, going through the bullet points, you can do it like this. Now that we have talked about the pain, let's move on to your daily routine. Let's say now that we talked about your symptoms, let's move on to your general health condition. Or before we finish, I would like to discuss your medication. Or before we proceed, I would like to ask you a few more questions. So these are all very good changing topic strategies. But what is more important, probably you don't notice, summarizing is essential. It's absolutely important. If you don't do it, you lose a score. So you must you must give a summary. And I told you, and I tell professionals that the best place for it is actually when you put a summary at the information gathering stage. You gather the information before you go to the information giving, you start actually giving a summary. Like, so just to recap, the pain started 3 weeks ago and paracetamol hasn't helped. Look, some of you say, Hocam, I don't remember what I can say here. Don't panic. You remember, every card has this background information. Do you remember that tells the whole story? I generally say if you panic and you forgot and you just really don't know what to say as a summary, you can just read the background information from your card by changing a little bit of that, and then you say, okay, you came here 3 weeks, you started 3 weeks ago, and this pain is like this, and so there is always a way. Don't worry. So don't get panicked. There is a solution for every problem you face. Let me go, or another way to summarize is, let me go quickly go over what we have covered or what we have talked about so far. And if you are gonna next step, you can also use this. What I'd like to do next is to explain the treatment options. That's another one. Now here is what will happen going forward. That's another way to talk about next steps. And does that all make sense before we continue or before we go on? Do you have any questions so far? Okay. That's another way of doing this. Let's say we call them signposting. Technically, we call them signposting, but they are fantastic and they are really helpful. Now, I would like you to understand a couple of communication mistakes. This is something more common than you think. And I would like you, if you are just joining this session, to just remember something from this session. Even if you remember this slide, it's good for you. You have learned something, okay? The first thing is, arkadaşlar, please do not ask compound questions. It's a routine. I do it. I'm sure you do it, but you should stop it because Cambridge is very specific about it. You know, they are really particular. Compound questions are asking are questions that are asking 2 or 3 things at one go. You know, it is very, very tempting to look at the card and say, okay, there are 5 options of different things. Let me ask all of them at one go. Never, ever do that. That will cost you score-wise. You should ask one question at a time. Again, one question at a time. So instead of saying, do you feel pain in the morning, in the afternoon, or at the night, or is it random? What do you say? When do you usually feel the pain? Let the patient give you information. And even this is really not a compound question. Sometimes they say, what's the frequency? So you ask, do you feel the pain in the morning? This, that, and then what is the frequency as well? No, that's too much. And usually, you know, guys, it's funny, but because I'm teaching how to do it, doctors come and I see these mistakes and I say, oh, I cannot give feedback. Of course, I'm smiling, you know, because I can see that they are losing a score, but I cannot do anything except that beautiful smile I'm putting on my face all the time. So don't do it. So if you are seeing me smiling in your room, it's not a happy smile always. It's just a smile that shows that there are many stories behind that. And dismissing the consent, we just talked about it. Do not just say, don't worry. How do you know it's not? So the patient says, how do you know it's not meningitis? This is part of the routine. So I don't think so. I'm a doctor. Are you a doctor? No, don't do it. It's judgmental. Don't ever judge the patient. Don't look at them when I say it's not meningitis because I'm a doctor. You are not. So you cannot talk like that to a patient. I mean, you can do it, but not in the session when you are recorded. So you should say, meningitis, give reason. Meningitis usually brings a high fever, stiff neck, which you don't have. So it is much less likely. Or you can even say, I completely understand you are worried about your condition, but let me clarify. Meningitis usually brings a high fever and then so I think first of all acknowledging that question is important. I always say acknowledge the question. Every question, by the way, let me tell you this. I am a professional patient. Those people who are interlocutor, they are professional. They don't say any sentence without any reason. So when I say something that sounds stupid, it's not. It is asking you to acknowledge, explore, and incorporate the patient's perspective. That's why you get a higher score. Bear reassurance. It's not serious. It's not really that reassuring, right? You need to give a little bit more. This is a mild self-limiting condition. Let me explain why. This is more reassuring. So when you see the word reassure the patient, don't just say, don't worry, it's not serious. No, provide reason why. Okay, let me explain why this is not a serious condition. Because this condition is mild, self-limiting, and it really gets resolved over time. Then this is reassuring. You provide much more context. And sometimes you have no transitions. I've seen this a lot more than you think. And these people are generally, this is the funny thing. People who have good English, they fail OET more than the people who have, let's say, normal English. Why? Because they say, I don't need class. I can go and do it. It's something I always do. I'm working in an international hospital. And they just come and just don't know any of these steps, jump from straight to the diagnosis. I gotta say, I shouldn't say, but one doctor for 5 minutes talked through the 5 minutes to me, did not ask any questions from me. And I was just like smiling the whole time because he was thinking the job of that role play card is he giving lecture to me. So his English was good, but I am 100% sure his English was good. I'm 100% sure he has failed because he got 0 point in clinical communication strategies. So you must have these transitions first, let me explain the diagnosis, then I will discuss the treatment options. Then you can say, based on the examination and your symptoms, my preliminary diagnosis is this. See, it is much more, understandable conversation. 3 grammatical points, and I promise you we'll stop. Do I have? Yeah, it's 9. Oh, so I'm gonna actually, it's not my fault. Kader took my time, so I'm gonna actually compensate and take more time of Kader. So 3 grammatical points. Some of you make mistake. Present perfect, guys. Present perfect is not present, is not perfect. Actually, present perfect is talking about past, and it's not perfect because everybody makes mistake with it. So if you are talking about something that started in the past, continued till now, present perfect, and we use it not like this. This is a mistake. For example, you can say, you are having high pressure. No, you have had high pressure. It is present perfect. You have had high pressure, blood pressure for 2 years, and that's the reason. Starting in the past, continue to know. Present perfect, we use for duration since for the starting point. Past simple versus present perfect. Which one do we use? Remember, if you say time, if you tell the time, for example, yesterday, last week, past simple. Past simple. If you don't say the time, present perfect. For example, I give you some medicine yesterday. Well, first of all, that's grammar mistake. Second, yesterday is mentioned. It is definitely past simple. I gave you some medicine yesterday. I'm sure you know this. You are familiar with this. Question structure. This is important. Do you feel nauseous or vomiting? This is not a standard question. Do you feel nauseous or have you vomited? These are because we don't use do you feel for vomiting. Do you have vomiting? Do you feel? Do you have feel? We don't use together. Have and feel are not used together. Feel is used for nauseous, have for vomiting. So you have to separate them. And more importantly than this, please be familiar with questioning, like question formats and orders in English. It is something essential. And then these are what things you do. 3 minutes, just nutshell, 3 minutes preparation. You have to know how to start. Based on the card, you start differently. And in our live sessions, we always talk about this. We always give practice to everyone. And then with relatives, you need to validate their feeling. For everybody, you need to validate their feeling, acknowledge it. Signposts are important. We talked about things that you shouldn't do. And also we talked about some ways to reassure better. Now it's time for the questions. Bring it on.
Okay, let's go.
You are my
think it's a good
translator. Do you have
beginning.
any questions in the chats?
I think they
We
do
have
have some
questions.
questions. Yeah, we have some questions in the chat. And so,
Shoot.
yeah.
Shoot the questions.
Firstly, someone asked if we lose any points in the same specific parts if we do not have a chat, if we cannot, finish all the questions.
That's a
All the
very
time.
common question. That's a very common question. I completely understand why you're asking this question. I'm acknowledging your feeling, right? No, there is no criteria. If you look at look, Cambridge is crazy. They always look at their criteria. There is nowhere in the criteria that says you have to finish the card. Okay, but still, those cards in the way that they are ordered for 5 minutes conversation. Generally, people finish, let's say, 5 minutes, 20 seconds. We have some leverage to allow them to speak a little bit more. However, remember, even if you speak more than 5 minutes, nobody is gonna give you mark your score on that because it's not fair. It's a standard exam. Only 5 minutes is assessed. 5 minutes. Even if you talk 10 minutes, well, they don't allow you to talk 10 minutes, but even if you do, they don't care. Just 5 minutes. Kader, go ahead.
Yeah, I just wanted to add a point right there because that's a very important question, a very good question. And I wanted to give you an example in Turkish. Arkadaşlar diyelim ki iki tane OET adayını hayal edin kafanızda. Bir tanesi bütün task'leri ele alıyor. Baştan sona hepsiyle ilgili konuşuyor ama kriterleri yeterince karşılamıyor. Diğeri task'lerin sadece %70'ini yetiştirebiliyor ama kriterlerin hakkını vererek karşılayabiliyor. O kişi %100 daha fazla puan alacaktır. Böyle bir örnek daha aklınızda kalıcı olur diye bu şekilde söylemek istedim. Mike Hoca da bahsetmişti zaten. Like the bottom line is it doesn't matter like how many tasks you cover. Obviously, you know, try to cover as much as you can. But the important thing is to give the criteria its due when doing the role play.
Yep, yep. Thank you for translating. Now, any other question?
Yeah, one more question also. Buse Aynacı asked if there is some specific thing that doctors especially should avoid doing during the OET exam.
Buse, that's a fantastic question, but the answer is very long. You actually you need to avoid so many things as a, let's say, a candidate. One thing that I would probably say is try to always avoid stopping interrupting the patient. That's the one thing. Second, avoid keeping, let's say, summary. Some of you say, I will summarize at the end. Don't do it. You will run out of. Always do the summary in the middle. If you skip it to the end, I guarantee you are gonna create a source of anxiety for yourself. Second, summary is very important. Do it in the middle, put it under wraps, and go on. Because if you don't do it, you lose a score, and that's the difference between a person who passes with a person who's just 320. So make sure you put the summary at the middle of the conversation, in the middle of the conversation, rather than the end. But there are so many other things that you should not do. But I invite you, Buse, to join our live sessions so that I can practice one. Because in our live sessions, if you ask doctors, maybe some of people who are attending this webinar, they
Yeah,
have
we
been
have
in my.
actually. Yeah.
We have some people who have been in. We
Yeah.
generally do one-to-one, the whole card, and I give detailed feedback to everything they did right and everything that they didn't. So you'll really learn things that you didn't expect. Even if you are not doing the role play card, because you're observing, you can learn a lot. Yeah. I generally don't. I am very mutavazi person, but mesela. But my live sessions are the best. Trust me. If I was a student, I would actually go to my own live sessions. Bu kadar ego.
Well, I can confirm.
Yeah, that's it. That's it. All right, I said it anyways.
And we have another question regarding the, role play cards. What happens if a topic comes up and we are not very, familiar with the topic? Can we use the guidelines as are, or is it something,
Very
back
good
to do?
question.
So,
It's a
Yes.
fantastic question. I don't know who asked it, but bravo, you ask a very good question. This question is about medical knowledge. Arkadaşlar, the assessor is somebody like me, as stupid as me. We don't know anything about doctoring. We only know language. We only care about your language. So if you prescribe acetaminophen for a stage 4 cancer, we say nice. We don't know and we don't care. So no, if you forgot anything medically, just say whatever comes to your mind. You're a professional, and if you make a mistake, nobody's gonna come and really hunt you or find you or punish you for that. There is no punishment for that. And there is one question I can see here. Can we take Fevzi asks, can we take notes as well on the online exam at home? Yes, Fevzi. If you are taking the exam online, still you can take notes. You need to show a piece of paper that is empty on the camera. But I have to tell you something, for some of you are not comfortable online test, okay? Some of you are comfortable. But remember, face-to-face seems more human to human interaction, and it's kind of like friendlier, I think, friendlier, because the person who's online is being recorded video. So if I'm examiner, if I'm interlocutor online, I am not that kind or nice. Why? Because I have to follow the protocols, and I am being recorded. But when you come to, let's say, my face-to-face interlocutor, I am smiling more, I am more comfortable. We can actually see each other, and we can read each other's, let's say, facial expression. And if you are worried, I can kind of like say something, my tone of voice and so on. We are more, I received this complaint from my OET students. They said, Hocam, this in interlocutor online was very aggressive. You can şikayet etmek if some interlocutor was crazy, but it doesn't change your score. It only punishes that interlocutor, and the punishment is not really big. They just receive a warning. Hello, Mr. Askari, why were you so crazy? That's it. Warning. That's the whole thing they do. There is nothing else. And
Okay, let's do one more question. Sorry.
Next question. Can you tell me the difference between IELTS, academic, and OET? I know both from Cambridge. Yes, I am examiner of both, so I can give you some examination. IELTS is totally different from OET. So IELTS is for the people who are going to study in academic world, like universities and so on. The format of the exam is different. It is is academic English, not general, academic English. And the language is academic. It comes from many different disciplines. So you can read the text in archaeology, in sociology, in psychology, in linguistics. But when it comes to OET, everything is medical. That's the biggest difference. Another difference is the task formats are absolutely different. And some people find IELTS more difficult. I can report that. But if you want to, if you want to know more, or you don't know which one to choose, always look which one you're more comfortable with. Are you more comfortable with medical context? Then OET is for you. If you feel like, no, I'm comfortable with academic text in general, then you can go to the IELTS academic version. Heather, go ahead.
Yeah, I don't want to be the bad, guy here, but let's do one more question I was about to say, and then we're gonna do a raffle at the end.
Yeah.
Çekilişe geçebiliriz. Ama 2 sorumuz kaldı. Can we use headphones during the online exam?
Mm-hmm.
This is one of the last 2 questions.
Absolutely, you can.
Yeah.
As far as I know, I don't want to give you the wrong information about this one. I think it is possible to use. I remember I did TOEFL IBT myself just to experience for my students. It was a home edition. In that, they didn't allow headphones, but I am not sure about. So let's say I am not sure. You can check online. Sorry for that.
I mean, what they care is make sure that there's an, exam security. They want to make sure that you show them the room and everything.
They ask you to show the room entirely and try
Sometimes
to
using headphones can imply, maybe you can get
some information from
someone
somebody else.
connected somehow.
That's why I think probably
They
not,
always
because
give you,
they need to
they
see
always
your
give you
ears.
like strict information prior to the test. So no worries for that.
Yes. A little bit, Kader, again, unfortunately, so many of my students actually had technical issues with their OET online.
Yeah.
So I have to tell you guys, some of them had to reschedule, and it was very stressful. I had some doctors actually mixed up AM and PM. Can you believe this? So I had a student who booked
Yes.
the test for 12 AM and connected 12 PM of that day. 12 AM is midnight. She was sleeping, and at noon she went in front of the camera. There was nothing, and then realized, oh my God, it was 12 that passed. So don't make mistakes like this.
Yeah, it can be stressful for the students.
Yeah.
So before we move on to the last session to do the, you know, raffle, we have one more question. Let's just cover it quickly so we can, you know, cover everyone's question. Somebody asked how do we really, you know, convert our tone from academic English to the, you know, explaining something, giving information kind of English in the, you know, live sessions. Do you practice that kind of live sessions? Absolutely, we do. Because one of the criteria itself called information giving. So that's what, you know, sometimes in some specific sessions with Michael, we only practice information giving. And that's one of its, you know, components.